So hair transplantation is really exciting for me because we've really entered this new era where our technique and technology has been maximized to ensure the most natural and best results we'll ever get. There are two major ways that we employ hair transplantation in our clinic. We'll either do the more conventional linear strip excision, but we also use a very advanced technique called follicular unit extraction, or FUE, to avoid having a linear scar in the back of the scalp. So to explain a little bit about each, let's go back into the history of hair transplantation. Back in the day, they would take big hole punches of hairs called plugs, and they would place them almost after doing a biopsy into the front in units of 8 to 10 hairs at a time. And this is how we came to understand that that can look very unnatural. And so FUE has replaced those techniques by actually taking individual follicular units, which are comprised of no more than 4 hairs at a time, but usually 2 to 3 hairs, to really maximize the most natural way of restoring a hairline. So what we do is we take this little device that has multiple phases to it. So it'll rotate, it'll oscillate, it'll vibrate along the hair follicle to maximize its extraction without any trauma or transection to it. Once we've taken those individual hairs out, we then actually place them one by one along the frontal hairline or into the crown, sometimes even to the beard or to the eyebrows, to restore the area of concern for our patients. Most of the time we have great success with very little transection using the FUE technique. But if we want to maximize survival of our grafts, we sometimes use another technique, and this is called linear strip excision. Linear strip excision is where we're going to the back of the scalp in more of a surgical procedure, and we take a little strip of that scalp comprised of skin and hair. Once that is closed surgically with stitches, we then go to the microscope and divide that strip into all of the individual follicular units. And why that's a little bit more precise is because, unlike FUE, where we don't see the bulb of the hair underneath the skin, with linear strip excision, we're looking at the bulb directly and dividing the hairs individually one by one. So this is a great technique that we use for men with advanced balding. We use this for women who can camouflage and conceal a scar in the back. We use it for people who have very, very curly hair. And we'll use it if we need to harvest single follicular units. These are just single rose bouquets, and we'll use that if we're doing an eyebrow restoration or a beard restoration or a frontal hairline restoration. So there's a time and place for each of the individual techniques. No one is better than the other. It of course depends on the technology, the person, as well as the patient themselves. But at the end of the day, it really requires a consultation with us to determine which technique is best for you.